Good afternoon, Dr. Dwyer. How are you today?
I'm doing well, Michelle. How are you?
Good, good. So thank you for joining us today. Looking forward to getting to know you a little better and know a little more about your practice, the New Jersey Spine Institute. So can you tell us how your practice, the New Jersey Spine Institute, is unique?
Yes. So, as you know, we're kind of centrally located here in Bedminster, New Jersey, right at the intersection of routes 206, 78, 287. We're unique in the fact that we've been here for over 30 years. And between myself and Dr. Vessa, we have over 50 years of experience in the field of spine surgery and spinal diagnostics. We're unique in the fact that we work with a PM&R doctor who provides us with electrodiagnostics like EMGs. Whenever we do a surgery, there's two surgeons at every surgery, so you get two brains at every surgery.
Wow.
We often discuss and collaborate on cases. And one of the unique features we have is that we do have in one of our satellite facilities, we have an on-site MR. So we can obtain MRIs rather easily, even without insurance authorization. We can move on that quite quickly because we're in-house. Additionally, we provide pain management services. Dr. Vess and I, although we're surgeons, are skilled in providing pain management injections, as our associate Dr. Choi is. And we do that at our surgery center, which is located 10 minutes away from our practice at the Ambulatory Surgical Center of Somerset. So it's really full comprehensive services as relates to diagnostics and treatment of spinal and orthopedic injuries, specifically spine injuries.
That's terrific. So then an injured person then would not have to be worried so much about logistics and getting places. Once they know where your office is, they can receive any treatment or diagnostics that they need. That's great to know. Okay, next, doctor, can you tell us a little bit more about your own qualifications and expand any more on the qualifications of your practice?
Sure, of course, be happy to do that. I trained at the New Jersey Medical School in Newark. After graduating, I completed a residency in orthopedic surgery at the New Jersey Medical School. That's 5 years of training after medical school in the field of orthopedics. I then went on to specialize in the area of spine surgery. To do that, I took on a fellowship at the San Francisco Spine Institute, where for a year did advanced training in the treatment of spinal disorders, both traumatic and degenerative. After that, because I had such a good experience, I even went to University of Hong Kong and did further research and studies at University of Hong Kong for a mini fellowship as well. I returned to New Jersey and became part of the staff of the New Jersey Spine Institute as the founder, but I also participated as a professor and surgeon covering spinal trauma at the Trauma Center in Newark, which gave me a unique and immense experience in treatment of spinal traumatic disorders. So I've got quite a strong background. I'm board certified by the American Board of Orthopedic Surgery, and I'm also board certified by the American Board of Spine Surgery, as is my partner, Dr. Paul Vessa, who is my partner in practice here at the Spine Institute. Dr. Choi is board certified in rehab medicine and in pain management. With that, aside from what our qualifications are academically, I've also, over the years, garnered significant experience in the medical legal arena as relates to both personal injury patients and workers' comp patients. I have the ability to perform independent medical evaluations, expert reports, and to perform expert witness testimony. And that's done both for plaintiff and defense work as relates to personal injury clients and patients.
That's very impressive, doctor. Thank you. So then you are comfortable and you're very experienced in working with personal injury patients and their attorneys then, is that correct?
That's correct. So I think that we really, because we have our own surgery center, because we have our own imaging, we have sort of the unique ability to work hand in hand with the attorneys and patients to sort of ease their way through the system we're experienced at knowing we require sometimes the verbal thresholds, how we can provide a report. And I think that there's things that as surgeons we offer that other medical experts and specialists may not be able to provide the same level of expertise and insight.
Doctor, regarding the personal injury cases, and in particular the auto cases, then you're familiar with the verbal threshold?
Yes, I am. Quite.
And then, for example, providing a certificate of permanency, which is one of those requirements in those cases, is that something that your office will provide?
We provide that, and it's actually a fairly routine procedure for us. Obviously, we know the criteria, can select that criteria and provide a letter, as I said, quite easily, routinely.
Good to know. Okay. And then, doctor, as a spine surgeon, what advantage or insight do you have that you can offer an injured plaintiff that as a specialist, that a treating doctor who is not a specialist can offer?
Well, first, as a surgeon, we are often the ultimate treating person. You may go through physical therapy, you may go through injections, medications, but in the end, it's often a surgeon becomes the ultimate treatment provider for alleviation of a traumatic condition. Additionally, on, say, sort of from the attorney's end, we have primary verification of the injury that occurs. You might have an x-ray that might suggest something. There could be an EMG that suggests some nerve problems. There could be an MRI that might suggest a disc herniation compressing a nerve. But when I'm at the time of surgery, I see the disc injury, I see the fracture, I see the compression of the nerve or the spinal cord. And really, that's just to almost say it trumps everything else we see. I visualize it, and there's no doubt about what I see. And that's sort of unique to a surgeon.
And so, doctor, are you, as a treating physician, are you willing to act as an expert witness for trial? In other words, if you're the treating physician, will you provide a report to the attorney and then, if necessary, testify at trial on behalf of your patient?
Yes, and that's something we've been doing for at least the past 20 years, maybe even 30 years. It's interesting that we often are called on as treating physicians to provide a report or testimony, either be it personally in court or deposition, video deposition. We're available for all those things.
Okay. And you have experience in deposition and video deposition?
Yes, fairly extensive.
And you have experience as testifying actually in court?
Yes, I do.
Great, good to know. Okay, now you've told us a lot about your services of your practice, the New Jersey Spine Institute. Is there any other particular service that you can describe to us that your practice provides?
Well, again, aside from the physicians who provide diagnostic studies such as pain, as EMG studies that we do, Dr. Choi, we do pain management procedures like epidural injections. Our staff is well qualified and experienced in working with attorneys' offices in getting authorizations or shepherding the patient through the process of getting them to the surgery center or to the diagnostic centers.
Okay. Doctor, regarding the PIP cases, so then your office and your staff is familiar with the procedures necessary in order to get treatment approved by PIP and then subsequent diagnostics, et cetera, approved by the PIP and paid for by the PIP. Is your office familiar with doing those things?
Yes, that's been routine practice for us for at least 10 years.
That's great, because the patients very often, it's very stressful when they know they need treatment, they know they need diagnostics, and then they're not getting approved properly by the insurance company, and that lag puts a lot of stress on the clients and the patients. It's great to know that your office knows how to handle that seamlessly. Okay, I've heard about a practice or a term, pain mapping. Can you explain that to us?
Yes. So when a patient has a soft tissue injury, it's often difficult to determine exactly where the pain's coming from. We want to identify what's called the pain generator. And over the years, at the New Jersey Spine Institute, we've developed sort of an algorithmic practice where we can determine what the true pain generator is. So which may differentiate a painful injured structure to just maybe a structure that may have some arthritis. And what we do is we'll do certain injections. And we know that in an injured, inflamed structure, if we pressurize it with an injection, will actually initially cause an exacerbation or worsening of the patient's pain. Similarly, if we put some Novocaine over that, shortly after worsening the pain, we can alleviate the pain. And that helps us to identify a pain structure. Another procedure we use is called the discogram, where we actually place a needle into a disc and pressurize the disc. An injured disc will reproduce the patient's exact pain, whereas somebody who has a disc that's maybe an aging disc and not an injured disc will not perceive any pain. So that helps us to target, if surgery is required, which disc is bad. Is the disc the pain generator? Is a joint the pain generator? And that's what we call by pain mapping. We'll actually map out the pain, and that gives us a plan of knowing what the exact traumatic injury was and what is required to repair or alleviate that pain.
And that's a technique that you use in verbal threshold cases?
It can be used in verbal threshold cases as well, yes.
Good to know. All right, thank you, Doctor. Doctor, this has been very informative. Is there anything else that you would like to add about your practice in New Jersey Spine Institute or your own qualifications or those of your partners and associates?
Well, I think that the things I'd like to be known for is I think that my patients, no matter where they come from, believe that I'm a patient advocate, and I try and get them the right treatment, and I do my best to make them get the best results from surgery. My partner, Dr. Vessa, feels the same way, and so does Dr. Choi. So we're quite proud of how hard we work for our patients, and we've actually tracked our outcomes for the past 10 years and believe we've got really superior outcome measures compared to other practitioners.
Well, Doctor, well, thank you. And I love the word advocate, and I'm sure that many of our colleagues would like that as well, because that's what we all are here as advocates for our clients. So the New Jersey Spine Institute, you and Dr. Vessa are both would be valuable members of any of the legal team that we're putting together for our clients. Well, so thank you, Doctor. Thank you for taking the time to talk with us today.
Well, thank you for giving this opportunity. I'm happy to support the illegal community in Hunterdon County.
All right, we'll be looking forward to seeing you soon.
Thank you. Have a good day.
You too.